Good evening, Pierce. This is David, and I wish everybody happy Thanksgiving. I hope you have something planned out for the holiday season, whether to relax yourself or to study. So today we will be diving deeper into one of the topics under qualitative research methods, which I gave a little preview last week. It's called inductive thematic analysis. So by its name, you can probably tell it's going from general to specific, inductive. So we're organizing information and making it more specific. In other words, we're going towards the top of the pyramid. And yeah, thematic is there's a certain theme, uh, whichever we are analyzing. And then analysis basically is what we're doing. We're trying to figure out a certain pattern or a certain ongoing trend for the data. Let me share screen and show you what exactly do I mean by that. So this is one of the studies two of my mentors and I conducted. I didn't get involved in the question design stage. They design all the questions. So as you can see, this is the original questionnaire for our participants / respondents. The study was about RCFE means residential care facility for the elderly during the pandemic. And we wanted to ask them various questions, such as, to begin with, more general questions, like, for example, number one, what is the size of the facility? Number two, does the facility owner own or operate other facilities, etc. As you go down, the questions become more detailed, not as generalizable, not as general as the first few questions. For example, number five, does the facility have an evacuation plan? That, compared to question number two, does the facility owner own or operate other facilities, is a yes, no, or unknown answer. Basically, it's close-ended. But questions such as question five, does the facility have an evacuation plan? That question is open-ended. There's no way for the facility owners or respondent who's in charge of that certain facility to say, oh, yes or no. That doesn't, of course, that doesn't make sense. So that's what I mean. We're going from general to a more specific in terms of questionnaire design. Like seven, for example, does a facility have a shelter-in-place plan? Obviously, this kind of question as adults and researchers, either you might be new to the research or you have dealt with research for some time. Obviously, the answer is yes or no answer, but after that, of course, there's an expectation of elaboration from the respondents. And they don't just answer yes or no. They'll tell you what the plan is, if there is. They don't just stop after yes. The questions such as 19, how confident did you feel in the facility's ability to meet the following recommended guidelines during the pandemic restrictions? This is a very detailed question. It wanted the respondents to include information, for example, screening of staff, communication with residents, communication with family, communication with nearby hospital, etc. We want that information as detailed as possible. This makes our analysis stage a little more complicated than if we had more general answers. However, the more detailed responses they provide, the more we can say about our study. For example, we can I'll discuss this later in upcoming videos. What we had to say about all these areas in the discussion stage. Excuse me. The discussion section of the research paper. Versus see if we didn't provide them with all these areas of response, if we didn't have any of those bullet points, we just wanted general answers, then obviously in the discussion section there can only be generalized writing. There won't be much breadth or depth, which means it won't encompass so many areas, nor would it go dive deeper into any of these areas. And then questions 21, 22, as you can see here, are add-on questions or build-on questions. For example, what, if any, challenges did your facility face during the COVID-19 pandemic related to staff stress and morale? This is in parentheses it says open, which means it's open and respondents are free to express their ideas. And you'll see later that we got a very satisfactory amount of answers. They were all the respondents / participants were very open and honest, and they shared what the specific challenges and stress came from. And of course, a lot of facilities, we use a generalized term, facilities. They include nursing homes, long-term care. If you don't really know the difference, you can look into them. I mean, there's more than 10 types of residential care facility for the elderly, just for information. So when we asked that question, we got answers from all these different types of facilities, director of operation, or people which are responsible for the facilities. And we were also able to write a lot about this part in the discussion section. And then 22, excuse me, what, if any, challenges did your facility face related to the distribution of COVID-19 vaccines? Again, I won't dive deeper, just like I discussed with question 21. This general, obviously everybody would have different answers. Everybody did have different answers in terms of the fear for contracting such disease, etc. And then 25, see, again, we're building higher and higher onto the pyramid, or deeper and deeper into the topic. These are excellently designed questionnaires by our principal investigators. What type of support / training would you find beneficial? Check all that apply in those areas. For example, establishing communication lines with nearby hospitals, state and local public health officials, facilitate disaster plan policies and procedures related to infection prevention, excuse me, etc., etc. So this is just a general overview of the questionnaires, of the questions in the questionnaire for the project. Here, you can see that we grouped the questions according to, this is one of the, excuse me, this is the beginning stages of inductive thematic analysis. For example, question 1 and 3. I'll go back to the questions. 1 and 3. What is the size of the facility? Question 1. Question 3. How many years have you been an administrator for this facility? So what can we say about these two questions? What do they have in common? Obviously, you can probably tell these are demographic questions for a certain theme. If we want to come up with something. So, they got grouped under demographics. And then questions 19 and 20. How confident did you feel in the facility's ability to meet the following recommended guidelines during the pandemic restrictions? 20. Please provide any additional comments you would like to regarding the facility's ability to meet the following recommended guidelines during the pandemic restrictions. Again, 20 is building on top of 19. After their answers, they will continue answering the question. These questions are in the same category. They're very similar. Again, they're in the same theme. As you probably saw earlier, and I'm going to go back to that page. And also, question 20 obviously has to be open-ended for the respondents to freely describe or discuss their feelings, ideas, etc. And then, pardon me. And there is also 21. What, if any, challenges did your facility face during the COVID-19 pandemic related to staff stress and morale? Again, it's building up on top of 19 and 20. And again, it's open-ended. This goes under the theme of staff experiences during the pandemic. Why do we do this way? Why do we group these questions? I'll show you later. There is a reason why we do that. It's for the ease of analysis. That's why it's called inductive thematic analysis. The questions are asking for specific detailed responses, right? And then in this stage, in the second stage of data analysis, we are already starting the inductive thematic analysis. We're going from here, very bottom, to the second step. We're grouping the questions into different themes according to what we want to find out. Here are the specific answers For question 1, for example, excuse me, I calculated the respondents' answers based on their feedback. What is the size of the facility? That's question 1 here. 1 to 6, there's 106. 7 to 16, there's 8. 17 to 49, there's 9. 50 to 99, there's 12. And 100 plus, there's 14. And then missing, that means somebody left this question blank. In the questionnaires, we didn't we didn't require the respondents to must answer certain questions in order to go on to the next one. If they skip it, they skip it, and then it's just missing data. So here, this is the frequency I just talked about. And then here, I summed them up, and I got 150% out of 150 of them. So here, if you add them up, it's 150. 1 to 6 is 70.7%, 7 to 16 is 5.3, 17 to 49 is 6.0, etc. Here, question 3, years as administrator, who trained the staff. These questions are similar. They are quantitative questions. And then, for example, regarding inductive thematic analysis, question 21, my mistake. This is here is the core gist of inductive thematic analysis. Of all the answers we obtained, there were 115 answers we got from respondents. And all these 115 responses for question 21, challenges to stress and morale during the COVID-19 pandemic, which I used as an example in the very beginning. 115 residential care facility for the elderly, RCFE administrators or directors. Their answers, please pay close attention. Their answers all evolved around certain core themes. That's why it's called inductive thematic analysis. We're trying to catch certain themes. As I also mentioned earlier, why are we doing that? Because we are trying to build discussion topics in many categories for us to talk about later on. So for example, what are those themes? We have 13 in total. So number 1 is isolation. Isolation is one of the most frequently appeared answers. And then 2, loss or death of staff residents. That's also another pretty high frequency answers. And then 3 is staff safety. What they mean by that is there were a lot of overtime required during the pandemic due to the loss or death of staff. The loss means they were they either quit the job or they were tested positive, so they had to isolate themselves, or some were even quarantined. When those things happen, less staff were called to handle more duties and longer hours. That's why a lot of them, their health were going downhill, and due to lack of sleep, long working hours, exhaustion, etc., fatigue. Also, there's another part of staff safety, which is the fear of getting infected, or the high likelihood of getting infected with the COVID-19 viruses. And then 4 is burden for responsibility for residents' happiness or safety. And 5 is fear of infecting others, such as family, staff, residents. And then I won't go on, you can read the rest. There's, as I was saying earlier, we are trying to organize them into certain themes, and these are the themes. 115 responses all got categorized under these themes. 13 is lack of training. And then what I did was that for example, oh, my mistake. There were 113 responses which got categorized into themes, because with number 1, 2, obviously 2 is just space, number 1 is question, so started with 3 and ended up with 115. There's 113 responses. So this response, basically, number 1, I won't read it. I'll let you read it. When we sum it up, there's 3, 9, 15. That means staff safety here. Staff shortages, quit, refusal to work hard to find new staff. And 15. Oh, I guess the principal investigators, they removed 15 because they might be, it was, I'm pretty sure it was similar to one of these themes. So we further grouped the 15 with another one together. And for example, 3 and 9 here, staff shortage, staff fear of exposure. That's their answer. 3 is staff safety, and then 9 is what we just talked about. Staff shortages, quit, refusal to work hard to find new. Three and 4. Staff safety again. 4 is burden of responsibility for residents, happiness, safety. Again, like usual, I conducted some calculations for the quantitative part. This is what we're doing is qualitative, inductive thematic analysis, but I still felt the need to calculate the percentages for each theme, the frequency of it appearing in 113 of these responses. So if we wanted to say something, for example, if we wanted to discuss theme number 4, which is burden of responsibility for residents' happiness / safety, we could say, oh, there's 23.89% of the administrators who expressed concern in this area or concerns, and then discuss it more with literature review or referencing other studies. Of course, we can do the same for all of these. So that's a generalized review for inductive thematic analysis. What I want to emphasize is that, like I mentioned, this paper we conducted for the residential care facility for the elderly during the COVID-19 pandemic, the challenges they faced. Although it's a qualitative paper, like I was showing you, I still conducted calculations in terms of quantitative means. And then there, of course, I will discuss this more in depth in future videos. We also talked about percentages, participants, etc. That means no matter the paper you're focusing on is quantitative or qualitative, if you're focusing on one like this one, qualitative, you can still discuss. We are always free to discuss some quantitative data. That doesn't mean we are just screened out or blocked, forbidden from discussing data in the quantitative measure in any way or form. It's not like that. They are always interconnected, quantitative study or qualitative study. Vice versa, if we were to conduct a quantitative study, we can still have qualitative questions in there. However, overall, one study, if it's quantitative, obviously it's going to have more quantitative questions. If it's qualitative, it's going to have a majority of qualitative questions. All right, this is a brief information overview of inductive thematic analysis. And I want to show you real quickly, how do we begin? So this is in the very beginning. Many of you must have done this in your classes or other research, or even the one we are working together on. So this is a literature review. In this study, I went through various, of course, we had primary data. In this study, we used primary and secondary data. Primary data were the ones I was just showing you. That's what my principal investigators collected during the study. And then I was mainly responsible for literature review. So I went and found many relevant research. And luckily, there were a lot focusing on the COVID-19 pandemic, the residential care facility for the elderly RCFEs experience during the COVID-19 pandemic. See, these are all very recent, 2022, 2020, 2021, and COVID-19 is nearly in every paper, maybe all of them. This is the very beginning where I've found the study, pasted the link here, title, journal, article, name, under which they were published, year, brief description. And then here, I organized them a little. Oh, my mistake. This is another study we're doing. Well, anyway, so I did a similar task with this study for the retinal care facility for the elderly. But pardon me, I just pulled this one out. So for the sake of time, I'm not going to go dig for the other document. But just disregard the title. You can see this is a second stage after I have collected all the secondary data from other researchers and scientists. The second stage, some of them, as we know, they aren't open to the public, so I just wrote overview. The first one is full text. And then see, this one is full text, etc. This is the second stage. And this is partial text. That means there is a shortened version, a brief description of the, for example, introduction, methodology, discussion, and then data, discussion, and then conclusion if there's any. So yes, this is basically it, and I wish you a happy remainder of the weekend. And if you have any questions, feel free to contact me by any means, and I'll see you in the next video.